If you've noticed you're not waking up with morning wood like you used to, your body is sending you a message. And trust me, you want to listen to this one. Look, I know this isn't dinner table conversation, but it's time we talked about something that affects millions of men, but almost nobody discusses openly. Morning erections aren't just some random inconvenience. They're actually one of the most reliable indicators of your overall health, especially your cardiovascular health. And when they start disappearing, it's often the first warning sign that something deeper is going on. The science. Here's what most men don't know. During sleep, healthy males typically experience 3 to 5 erections per night, each lasting anywhere from 25 to 35 minutes. This happens during REM sleep, and it's your body's natural way of keeping everything in working order. Think of it like your body running a systems check. These aren't triggered by sexual thoughts or dreams. They're completely physiological. Your testosterone levels peak in the early morning hours, your parasympathetic nervous system is dominant during REM sleep, and your brain is essentially testing the equipment. But here's the critical part. For this to happen, you need proper blood flow. The same blood vessels that supply your penis are similar in size to your coronary arteries. So when you stop getting morning erections, it often means your blood flow is compromised. And if it's compromised there, it's likely compromised in your heart too. In fact, erectile issues often appear 3 to 5 years before a heart attack. Your body is literally giving you an early warning system, and most guys are ignoring it. The common causes. So what's actually causing this? Let's break down the usual suspects. First, sleep quality. If you're not reaching deep REM sleep regularly, you're not giving your body the chance to run these natural cycles. Stress, alcohol, sleep apnea, scrolling your phone until 2 a.m., all of these destroy your sleep architecture. Second, cardiovascular health. Poor diet, lack of exercise, obesity, high blood pressure, high cholesterol. All of these damage your blood vessels over time. And remember, the blood vessels in your penis are the canary in the coal mine. They're smaller and show damage first. Third, hormones. Testosterone naturally declines with age, but it shouldn't plummet. If you're under 40 and experiencing low T symptoms, something's wrong. Poor sleep, chronic stress, lack of exercise, vitamin D deficiency, excessive alcohol consumption, all of these crush testosterone production. Fourth, psychological factors. Chronic stress floods your system with cortisol, which directly antagonizes testosterone. Anxiety and depression affect your nervous system's ability to trigger these automatic processes. And if you're dealing with relationship stress or performance anxiety, your subconscious doesn't take a break just because you're asleep. Fifth, medications and substances. Antidepressants, blood pressure medications, alcohol, marijuana, and especially pornography addiction can all interfere with your natural sexual response cycle. But here's the good news. For most men, this isn't permanent, and the fixes are actually pretty straightforward. If you like what we do here, please like and comment. Let us know what you think, and please subscribe to the channel. It means a lot to us and helps us to grow and make new videos on men's health and well-being every week. Now, back to fixing men's missing morning wood. The solution. Let's talk about what actually works. Start with cardiovascular exercise. I'm talking about 150 minutes per week, minimum of moderate cardio. Running, cycling, swimming, whatever gets your heart rate up. This improves blood flow throughout your entire body, including where it matters. Studies show that just 30 minutes of walking per day can reduce erectile dysfunction risk by 41%. Next, strength training. Lifting weights naturally boosts testosterone production. Compound movements like squats, deadlifts, and bench press are particularly effective. 3 sessions per week will make a measurable difference in your hormone levels within weeks. Fix your sleep, and I mean really fix it. Get 7 to 9 hours. Make your room completely dark. Keep it cool. No screens an hour before bed. If you snore heavily or wake up gasping, get tested for sleep apnea. This alone could be the entire problem. Clean up your diet. More vegetables, lean proteins, healthy fats. Less processed garbage, sugar, and excessive alcohol. Your cardiovascular system runs on what you feed it. Specific foods like dark chocolate, watermelon, spinach, and nuts have been shown to improve blood flow and nitric oxide production. Manage your stress. Meditation, therapy, breathwork, journaling. Find what works for you. Chronic cortisol elevation is an absolute testosterone killer and vasoconstrictor. You cannot out-exercise or out-supplement a chronically stressed nervous system. Get your levels checked. Ask your doctor for a comprehensive hormone panel. Testosterone, estradiol, thyroid function, vitamin D. Don't accept normal if you're experiencing symptoms. Optimal is different from normal. And here's a big one that nobody wants to hear. Assess your relationship with pornography. The research is increasingly clear that excessive pornography use can literally rewire your brain's reward system and desensitize you to normal sexual stimuli. If you're watching porn daily, try a 30-day reset and see what happens. The reality is, your morning erection is like a check engine light for your body. When it goes off, you don't ignore it. Quick pause. Before we continue, here's something worth knowing. If you've been feeling frustrated or even embarrassed about changes in bedroom performance, sensitivity, stamina, or desire, you're not alone. And it's not your fault. There's a 100% natural solution that's already helped thousands of men feel confident and energized again. No pills, no injections, no procedures, no surgery, no risky shortcuts. Just a simple, easy home remedy you can make at home, designed to support what researchers are now calling the manhood molecule, a key factor for arousal, blood flow, and lasting power. Find out more. There's a link in the description and in the pinned comment. When to see a doctor. Now let's be clear about when this requires medical attention. If you've had a sudden change, like going from regular morning erections to none within a few weeks, see a doctor immediately. This could indicate a vascular issue, nerve damage, or hormonal problem that needs attention. If you're experiencing erectile dysfunction during sexual activity as well, definitely get checked out. This isn't just about morning wood at that point. If you have other symptoms like chest pain, shortness of breath, extreme fatigue, mood changes, or loss of muscle mass, these compound concerns and warrant a comprehensive evaluation. And if you're on medications, talk to your doctor about alternatives. Many blood pressure and antidepressant medications have sexual side effects, but there are often alternatives that work just as well without these issues. Closing thoughts. Look, I get it. This isn't comfortable to talk about, but your sexual health is directly connected to your overall health. These morning erections aren't some trivial inconvenience or joke. They're a daily report card on your cardiovascular system, your hormones, your sleep quality, and your stress levels. The fact that you're watching this video means you've already taken the first step, acknowledgement. Now take the second step, action. Your body is trying to tell you something. Are you listening? If you got value today, please like, comment, and subscribe to the channel. Remember to check out the 100% natural home remedy that thousands of men are using to boost passion and stamina in the bedroom. No pills, no pumps, no surgery. There's a link in the description below and in the pinned comment. Now watch this for more ways to stay healthy, stay fit, and stay vital.